I don't know much about it, and I'm kind of wondering how it's going to, affect me, because I'm 84 now. Does it affect me very much?
I'm in my early 50s and was wondering how the new health care law would benefit me.
I would like to know how the new health care law is going to affect my children, grandchildren, and great-grandchildren.
Welcome back. I'm Kathy McClear with AARP South Dakota, and I am joined by Sarah Jennings, AARP South Dakota State Director, and by Sam Wilson, Associate State Director for Advocacy. We are talking about the Affordable Care Act and how it impacts you and your family. Earlier, we talked about some of the new benefits individuals in Medicare are receiving as a result of the law, but those younger than 65 often face challenges in finding affordable health care coverage. Kevin Kavanaugh is looking forward to retirement in a few years, but when his wife recently took early retirement, he learned one of the biggest financial challenges they face is finding affordable health care coverage.
We had very good health insurance coverage for our entire working lives.
After doing his homework, he discovered the best option was for his wife to keep her employer health plan, but at a much higher cost.
We're paying 3 to 4 times the premium that we were when she was employed.
Kevin won't have that option when he retires down the road. His employer doesn't allow him to keep his insurance post-retirement at any cost.
In a couple years, I'll still be under 65, still not eligible for Medicare, so then I have to go out on the open market, and I don't know if many people can afford those prices at age 63 or 64. You just cannot afford it.
And Sarah, for someone who's close to Medicare age, what's in the law for them?
Well, the good news is that if you have coverage that you like, whether through your employer or some coverage that you've purchased, you can keep it. Nothing in the law changes what you already have, which is great news because there was a lot of concern about that during the debate. But for those 32 million people across the country who are uninsured, and right here in South Dakota, we have between 10 and 15% of our under 65 population have no health insurance at all. For that population, there's also a lot of good things in this bill to help them be able to get the care they need when they need it and at a more affordable cost than they've been able to date.
Okay. Well, let's take another question.
I'm a few years away from Medicare, and I was wondering what the new health care law will do for me.
And Sam, for that crowd who's maybe not yet 65, but they've already decided or they're lucky enough to retire, what's in the law for them?
There's some important benefits coming in 2014, particularly in the area of age rating. One of the things that many older adults who have not quite reached 65 are subject to are age rating limits, and that's when an insurance company can take a look at your overall health, your age, and actually charge you more than they would a younger individual, even if you are completely healthy, simply based on your age. And so that's one of the challenges right now folks just under the age of 65 are facing, and in 2014, those age rating limits will dramatically lower on a national level. The other thing that's going to be available are health insurance exchanges, and health insurance exchanges are meant to be portals for individuals to find health insurance coverage. Oftentimes the most difficult part is navigating the insurance market, knowing exactly what benefits you need and being able to compare prices from company to company. The health insurance exchanges are going to be there to help people navigate that process. In addition, those insurance exchanges will also facilitate the payment of subsidies for individuals to purchase health insurance coverage. So people should really look forward to in 2014 not only better consumer choices in the insurance market, but they'll have better tools to choose their insurance product, and they're also going to have subsidies available to them to purchase that coverage. So it really is, in a sense, a trifecta of assistance for people under the age of 65 looking for health insurance coverage.
So really trying to just make it more affordable for everyone.
Absolutely.
Great. Well, let's take another question.
I have a pre-existing condition, and I was wondering what the new health care law will do for me.
Sarah, another great question. How does the health care law address that?
Well, the great news is that already no child can be discriminated against to get health insurance because of a pre-existing condition. So that is a great change that's already helping families all over South Dakota. But coming in 2014, and that seems to be the magical year that Sam was referring to, there's a lot of changes that are coming in 2014, so we all have to be a little patient. But coming in 2014, all adults then can no longer be discriminated on based on having a pre-existing condition of some sort. So that's going to really open up the ability to get health care insurance to so many more people who have really struggled until now.
And Sam, 2014 is a ways down the road. What's in place now for people who maybe have pre-existing conditions and are deemed uninsurable?
Well, there is a plan in place to transition people between the present and 2014. There's what's called the pre-existing condition insurance plan, which is available to people actually nationwide for them to at least have access to one insurance plan that will not discriminate against them based on a pre-existing condition. Now, these are not free insurance plans. That needs to be noted. However, in many cases, just having access to a single plan is a difficult thing to have, even whether you be in South Dakota or in other states across the country. So there is this temporary plan which is in place that people can access some health insurance benefits until we get to 2014, when, as Sarah said, the pre-existing condition exclusions for many people will simply go away as a result of the new law.
Okay, great. Thank you. Let's take another question.
I'm in my early 50s and was wondering how the new health care law would benefit me.
So Sam, what's in the Affordable Care Act for folks who maybe are in their 50s and are still raising families?
There's some critical consumer protections which are now in law that will protect people from not having coverage when they most need it. Most notably, there's now the elimination of lifetime limits on coverage for their insurance benefits. So you will not find yourself, whether you have a catastrophic ailment or something else, you will not find a limitation in your coverage based on some sort of arbitrary dollar amount that your insurance company may have established for your health plan. That's a critical piece. We'll also be seeing an elimination of annual limits on benefits because, as we well know, people may have long-term catastrophic needs, but they also have short-term catastrophic needs that they may be able to recover from in the future. And so we'll eliminate those annual limits going forward. There's also the elimination of a practice called rescission. Rescission is basically the voiding or deletion of insurance plan, largely because of a clerical error or some sort of technicality. Usually that's caught when the person who's needing benefits goes through the insurance claim process, and all of a sudden the insurance company says, you know what, we found a technicality, we're not going to honor your plan, and you no longer have access to benefits. That practice, albeit rare in South Dakota and many states, does exist, and this is eliminated by the Affordable Care Act.
Okay, Sarah, the folks that are in their 50s, we know that those folks are still raising children. Maybe they have college-age kids, and certainly in these challenging economic times, maybe you have a college grad that moved back home for a while, or maybe is having a hard time finding a job. What's in the Affordable Care Act for those folks?
Well, there's a really important provision that we know many South Dakota families are already taking advantage of, and that allows a child up to the age of 26 to be on their parents' health insurance. And this is a provision that is saving, well, it's number one, making sure that we have those younger kids who sort of think they're invincible and nothing could harm them, making sure that they do have the coverage that they need when they need it, and then just making, it's much more affordable to just lump them into their parents' care rather than having to have them, in some cases, go out and buy one on the private market if they aren't employed yet. So it's really a great benefit. I've heard of a lot of South Dakota families already taking advantage of it, and so that's at least one thing that we didn't have to wait till 2014 for.
Great. Well, both of you, we've covered really a lot of ground today about the Affordable Care Act. Sam, just a few last thoughts on this law is now in place and people are starting to see some of those changes happen and looking forward to a few more. Just some final thoughts.
What we're seeing is a tremendous increase in consumer protections for people in the insurance market. We're seeing a dramatic increase in benefits, not just for Medicare beneficiaries, but benefits for people who are under the age of 65. And we're also seeing, finally, a greater degree of affordability in the insurance market for those people under the age of 65, and a greater degree of affordability for Medicare beneficiaries as well. So, as has been stated several times in this program, there really truly is something for everyone in the new health care law. People need to be educated on that. Certainly AARP stands ready to educate not only our members but the general public on the new provisions of the Affordable Care Act. But people also need to know that there are resources out there other than AARP that stand at the ready to make sure that they know how to best access these benefits.
So really it sounds just being a good consumer.
Absolutely, and the South Dakotans are usually pretty good at this, either finding the right dealer, making sure that they're using benefits and things as smartly as they can. And so, as Sam said, there are a ton of resources out there people can tap into, and we would love to be a resource, but there's also the SHINE program and other places right here in South Dakota. And there's a lot of websites you can go to, but I know not everybody's comfortable finding information that way. So if they want to talk to a person, they can pick up the phone and give our office a call, and we'd love to help them answer any questions they may have.
So bottom line, really no one has to try to go this alone, that there are plenty of places that they can seek the information that they need.
Absolutely.
All right. Well, Sam and Sarah, thank you so much for the great information today. We've really just scratched the surface on the Affordable Care Act, highlighting some of the key aspects of the health care law that are already in place and a few of those that are still to come. It is important to stay on top of changes so that you can make the best decisions for you and your family. One way to do that is through AARP's interactive online health law guide. Just visit www.aarp.org/health law guide, and in less than 5 minutes you can answer a few simple questions to learn about the benefits and protections that you can get right now. What you'll get is a personalized report about how the law works with your existing coverage or what other health coverage options you may be eligible to get. On behalf of AARP South Dakota, we thank you for joining us today. Being informed can help you make the best possible decisions for you and your family. If you still have questions about the Affordable Care Act, visit aarp.org/getthefacts. As always, the staff at the AARP South Dakota office is available to help answer your questions or provide educational information and resources. And if you'd like to know more about AARP South Dakota and what we do in your community, we want to hear from you. Find us online at www.aarp.org/SD. Email us at sdaarp@aarp.org or call us toll-free 1-866-542-8172. Thank you for watching.